All right, good morning, good afternoon, everyone, depending on where you are. I want to welcome you all to today's webinar. It's called An Inside Look at the Home Healthcare Industry. Today we're joined by Rob Dezso, a BrightStar Care owner and based in Florida, as well as Pete First, who is the Senior Vice President of Franchise Development at BrightStar Care. So during the conversation, we're going to be highlighting several different aspects of the home healthcare industry in the U.S. That are helping to spur the growth of the segment. And before we get going further into the conversation, just want to remind everyone that it should last about 45 minutes in total, with probably about, depending on how the conversation goes, 10 to 15 minutes at the end to take any questions from those people attending. Let me just transfer the slide here. All right. And to ask any questions, there should be a Q&A box that you can enter your questions in. And as we go along through the conversation, you can ask us anything, and we'll try to answer as many as we can after we finish the more formal part of the webinar. So feel free to enter those questions, and then after the webinar is finished, we'll be recording the entire thing, so you'll be emailed the whole presentation. Cool. All right. So without further ado, we're going to introduce our speakers a little bit more. So as I mentioned, today we have Pete First and Rob Dezso. Rob is a BrightStar Care franchisee based in Melbourne, Florida. Prior to becoming a franchisee, he spent 14 years with Eli Lilly, pharmaceuticals company, which provided the perfect segue into the home healthcare marketplace, as Rob had been certified and trained in multiple disease states, including osteoporosis, cardiovascular, diabetes, depression, and senior care. And then prior to Eli Lilly, he was a sales manager for Shredded, a startup franchise in the Mobile, Alabama area. He also operated his own business in Lake Lanier, Georgia for 5 years that included retail sales, restaurant operations, boat rentals, and repair and modifications. Rob is married to his wife, Amanda, and they enjoy traveling, outdoor activities, and being active parents and grandparents. So Rob, thank you for joining us today.
Oh, welcome everybody.
And then we have Pete First. Pete is BrightStar Care's Senior Vice President of Franchise Development, as I mentioned earlier, with extensive background in the franchise industry, coupled with his goal of expanding the brand to new untapped markets across the country. Pete is primarily responsible for the brand's domestic franchise development. His day-to-day responsibilities include providing leadership, strategy, and direction to the franchise sales team, in addition to putting systems in place that improve the overall franchise sales process. So Pete's growth goals include adding franchisees to the brand in an effort to rapidly expand to new and currently underserved markets. So Pete, thank you for joining us today as well.
Thanks, Daniel. Welcome, everybody.
All right, and then just to give you a little bit more information about BrightStar Care, Pete's gonna speak a little bit more about the brand.
Yep, so we're based in Chicago, so we're a national private duty home care medical staffing franchise. We've got about 340 locations where we provide medical and non-medical services to our clients within their homes. We also do a lot of staffing with corporate clients as well. So we've got franchise locations across the country. And from an employment perspective, we employ over 20,000 caregivers and 3,500 nurses across the country in our locations. One of the unique things about us is that we are the only brand to achieve the Joint Commission's Enterprise Champion for Quality Award every year since that's been awarded. So this is something that hospital systems like the Mayo Clinic and Cleveland Clinic and the like are the accreditation process. We go through the same thing. So we're the only home care company that can say that, which is pretty unique.
Awesome. Cool. And before we dive into all the topics, I just want to give everyone a good understanding of what we're going to be covering today in more detail. So you can see we're going to be talking about the industry itself, how large it is, and the kind of the revenue that it generates, how the demographics in the United States are changing, shifting towards an aging population, and in keeping with that, how there's a greater trend for people seeking comfort at home as they do age, which has an impact and kind of reflects shifting in healthcare standards and operations. Then we'll be discussing how the industry is, relatively fragmented, and then kind of finishing everything up with discussing how home healthcare is a recession-resilient business model that tends to do well during challenging economic climates. So without further ado, we'll kind of jump right into that first topic. So home healthcare is it's a $100 billion industry. It has grown substantially over the past several years. Between 2015 and 2020, grew at an annualized rate of 4.3%, reaching, like I said, over that $100 billion mark. And in 2020 alone, it grew by 6.7%. So there's a lot of momentum behind the home healthcare segment, and we're going to talk a little bit more about what is spurring that type of growth in the following slides. So, all right, with an aging population. So, Pete, I think.
I can jump in here. So if you look at these slides and you look at the Americans 75 and older, in 2020 now the 75 and older demographic is almost at 23 million. So in 2050, that figure is anticipated to double. So they're reaching 46.2 million people at age 75 and older. And then if you factor in that there's 43 million Americans at age 65 in years 2012, now that number is expected to jump to over 72 million by 2030. So it's no secret that the aging population continues to grow, and it continues to fuel interest in this particular industry. And that's that's an area that we're able to really focus on and grow with the industry as we grow our franchise system.
Excellent. And Rob, I don't know if you had anything that you wanted to add into that conversation, and even segueing into the next part, but anything you're seeing as a franchisee on the ground.
Well, in all fairness, I am in Florida, so I believe these numbers are a little skewed, a little higher in my world. So as people tend to retire down in this side of things, but the reality is that's all mixed with the aging population and that growth, and just people's desires, honestly, to stay home. That's their plan. The American dream is buy your home, and they want to stay in it. So it kind of goes hand in hand with that aging population and their desires to stay where they're at. So those things kind of go hand in hand.
All right, I'm trying to make the slide go, so just give me 1 second. There we are. All right.
Yeah, I think these statistics really say it all. When you look at the percentage of people who want to remain in their homes once they reach the age of 65 and over, from our standpoint, there's no more important message today and desire than people that want to stay home, and that's the safest place to be. So being able to provide the care that we can, not only in the personal and companion care side, but also getting into the skilled care side, we're able to help our families and loved ones stay home even longer than before. And in today's time, that's more important than ever.
And even in that realm of seeking the comforts at home is the ability to provide the one-on-one care that we do and the level of safety that adds to what our capabilities are makes a really big difference. So it's not just being able to stay in their homes, but to be able to stay in their homes safely is really what's driving this segment to seek home health care and the different avenues that we have. So when you look at that 90% of people over 65 wanting to stay there, that's a great desire. But if they don't have a system in place that allows that to happen, some of their choices are not so great out there, and the cost of some of those choices are pretty large as well. So it's an investment to have to take the alternative mode as to staying at home. So.
Awesome. Those are great points. And kind of in line with the whole ability to be able to age in place and get the care that people need at home, is kind of the sense that the whole dynamic of healthcare is shifting within the hospital space. And I think Rob and Pete, you guys can speak a bit more cogently on that, just as far as transitioning care into the home to reduce readmissions, how the level of care that home healthcare agencies like BrightStar Care can deliver, make that a realistic a reality for people who need higher skilled care at home, and that sort of thing. So I guess Pete or Rob, whoever wants to tackle this a bit more in detail, go for it.
I'll jump in there, Pete, on this one. It's when you're looking at this shift in healthcare, one of the things we're predominantly seeing is that move for people to have shorter hospital stays. So managing that cost of healthcare overall, hospitals account for a large abundance of that. When people are staying there, it's an expensive stay, insurance companies paying for it. So that push to get people out of the hospital sooner plays right into the model that we have. We have a lot of programs that we call transitions in care. But to take a step back, as Pete alluded to, that joint commission accreditation, this is where that really comes into play, because when you're trying to have conversations, clinical discussions with hospitals, rehabilitation centers, and the likes, to be able to stand firm on your quality measures, especially when they're looking at readmission rates and their own quality measures, and to have that joint commission standard behind you, lets you be very relevant in those conversations. So it is a great foot in the door to be able to have that conversation with the right people. But then with that referral program and people coming out, there's so much opportunity with that. It's both on the skilled side as well as the personal care side. So it just opens up such an opportunity for us to go down these different avenues by far. With that being said, the hospital readmission rates, and they're measuring them out further now. If you have any background in healthcare and kind of knew in the past, they had a 30-day readmit rate. With these numbers now, with Medicare especially looking at 90 days, it is more important now than ever for hospitals and physicians to make sure there is a plan in place for when people come home to make sure they don't have issues and end up back in the hospital. And we are set up perfectly to coordinate that sort of activity, and that's what we call transitions in care. So you take that with just regular hospital stays, and then you look at people that have already transitioned from a hospital setting, and they go into a rehabilitation facility for further rehab prior to going home. That same rule of thumb applies when dealing with those rehab facilities and soliciting them to refer to us to then step in when they're done with their clients, so that we could take over and then once again keep that continuum of care going, so there is no readmission rate issues, and patient safety is standing tall for that as well.
And Rob, I think you also mentioned that you had some experience or are working a little bit with the telehealth side too.
Yes, I mean, so on the telehealth side, especially with the things situated with COVID right now, it's thrown a lot of different things into play. And so one of the things I know we're doing is we're in a pilot program that we've been doing a lot of different things around telehealth, but even monitoring clients in different ways using technology, but being able to communicate with the clients, being able to have these calls with physicians, making sure everyone's in the same loop. It's this coordination activity that is so important. So when you're having clients placed in your care, whether you're dealing with the doctor and setting up the visits now, with iPads and what else, Facebook for, have their portals at times we're using to make sure the doctors now have access to our clients one-on-one. having that technology backed by, BrightStar's forward thinking on these things allows us to better position ourselves once again with top referrals, so they can see us embracing technology that speaks in terms of how they can still have access to these clients and having that highest level of service.
I think as we move forward and many more states, go towards the higher minimum wage, this is going to be an area where we can really shine in the fact that we've got the telehealth capabilities as well, where the families that could handle 15 hours a week, 20 hours a week, maybe now that's down to 10 hours a week, but it's offset by telehealth. So some great opportunities there, and technology continues to change. So we're adapting with that and using that to, in some cases, get in the door, and in some cases continue the good quality and high quality care that they clients need, and it just allows them economically to make more sense.
Yeah, with that being said too, for people that are on here listening, for what are the opportunities, what are differentiators between one home health agency and companies that stand behind it. One of the things I could speak to directly is with BrightStar Care, the ability to pivot from one position to another, and not being afraid to look at the challenges that are facing us today, and taking steps and opportunities to try so many different things to try to find what the right mix of those opportunities are, and mixing it with technology to be able to kind of move the ball forward. One of the things I could definitely speak to is the fact that BrightStar Care is not afraid to put a program in place, set up a pilot program, let's see how this goes, and being able to pivot if another opportunity presents itself, so that we have a better opportunity to service our clients and our referring partners better. BrightStar Care has not been afraid to step in that new direction. A lot of times you get that, you sign up for something, you kind of locked into it, but the mentality here at BrightStar Care is quite the opposite. Whatever the opportunities are to offer better opportunities for the franchisees, as well as servicing those clients, and I said the referring agencies, that's been one of the best advantages that I've seen, and COVID's proved that point pretty solidly, without a doubt, with the ability to look at the opportunities that presented themselves, and our ability to step in there so quickly, getting PPE equipment, getting technology, putting all these things in alignment, having calls on the fly to make sure that we could service our communities in this strange and unusual time. It speaks volumes to the organization, and the bottom line numbers, it speaks to that as well, is because of that ability to take action in that short amount of time, where other agencies might have been suffering, not knowing what to do, some of the drop off in referrals just based on the state of conditions. We didn't have those issues because we were pivoting right into the sweet spot of what was going on. So just a little more background on that.
Yeah, that's a great point, Rob, because a lot of that, I mean, that's a direct result of the leadership that we have with Shelley Sum, with our founder. So we're not private equity owned, and that allows us to move quickly on opportunities and make decisions. Shelley went out and sourced over $2 million worth of PPE to ensure that all of the franchisees and all of their caregivers had access when the access was so limited. And this was early on in the pandemic. So being able to do those things and having a national accounts team and a business development team that's out there building relationships with national companies, to get involved with not only with the temperature checks for essential services and for the airlines and for various places that we were involved with, but now to be involved and providing nurses for one of the largest vaccine trials that are going on across the country, and then to be positioned in place to provide the vaccine once it's available. So these are the types of both regional and national partnerships that we're able to build based upon the leadership that we have and the way that BrightStar has the company.
Fantastic. And that kind of segues into the next section that we're going to discuss, which is kind of talking about how the industry it's fairly fragmented in the sense that there are numerous types of home healthcare agencies, they're kind of rapidly growing in the number, but the majority are limited to certain types of care. So there could be companion care and personal care, which are the most common types, and then there are the more premier home care businesses that offer more of the full continuum of care, which includes that skilled nursing component, which helps the agency owners to retain clients for longer and secure the type of partnerships that you guys have been discussing with other healthcare organizations and other national organizations. So, yeah, Rob or Pete, what have you seen, or can comment a little bit more on how this impacts you?
Well, I'll speak to it from it being an owner perspective on this. When you look at the slide right there, and you have companion care, personal care, and skilled care, and you think of the different company makeups, that some may only do companion care, some may do companion and personal care, and then you have like us with BrightStar Care that does all three of those. Some of the arguments from the competition will say, well, we specialize in this, so we're better at this. The reality is, when you look at those three things, it's not the equivalent of choosing if you want to go to an Italian restaurant or a steakhouse for dinner, or a Mexican restaurant. These are all the difference of having an appetizer, the main course, and dessert. What clients are looking for is someone who could come in and provide quality services through this entire spectrum, because that transition between companion care and personal care is not something that can be identified and say, I'm going to need that 3 months from now or 6 months from now. So you have to meet the clients where they're at and be that company that could grow with them and meet their needs as the aging population goes through their process. And each individual's time on these is completely different. The skilled nursing aspect gives you more of that validity of the quality and the skills that you have as a company to meet the needs of the community. Now, whether that client needs that skilled nursing care right away or at all doesn't come into play sometimes, but having that in your back pocket and them knowing that you have those capabilities gives you a lot more credibility in that community. So I don't look at the companies that are out there doing just companion care or just the personal care. I think they're missing the big opportunity here of the growing market, especially on that skilled nursing side. That is a segment that is growing, and we have so many national contracts with BrightStar Care that there are so many opportunities for doing IVIG, infusion therapies, wound care. You do so much with workers' comp. I mean, the list goes on of what the opportunities present themselves, and they do such a great job of giving us those opportunities. But that competition differential there, I can't begin to tell you what it's like when you walk into a home and you have these discussions, if you're going to do the private duty side, of having that background behind you, and that just in case that skilled nursing is needed. Because with BrightStar Care, we do an RN assessment, and that's the start of care with everyone. So you're having to have a nurse on staff anyways, and be able to recruit and let our clients and caregivers know it. Having that nursing staff, you just can't beat having that.
And then if you look at it too from the referral standpoint, if we're working with discharge planners and other referral sources, who would they want to call more than somebody who is their one call, where they know that we can take we can service all of their needs. So it makes that transition to for us to be able to provide that service that much easier, because they know that with one call we're able to work with wherever that particular client is at.
Excellent. Great. And then kind of heading into the next section about, and this kind of goes hand in hand with what we're just kind of describing with having the full continuum of care, and potentially that putting you guys in a stronger position when it comes to dealing with recessions, or even a timely topic is the pandemic from this year and how it's impacted kind of business owners all over the place. But just to give some context, with the home care franchises outperformed other franchises or other franchise concepts in the years after the Great Recession, according to some research from IHS Global Insight, which is, kind of giving you guys the opportunity to say, hey, we do well during these challenging economic climates, but I think this year has, provided almost like the perfect case study to showcase that again. And I'm sure, Rob, you've got some stories about how you've dealt with COVID-19, and Pete, for the brand, about how the whole company has managed these challenges.
Yeah, I mean, as far as recession resilient, I mean, we were hiring all throughout, since March. We haven't stopped hiring. The whole process with COVID, what it did in the home health industry is it started making people pause a lot more too, with regards to, am I going to put my family in an assisted living facility now that I can't even visit them? So for us, it halted a lot of those entrants that would normally have gone into an assisted living facility, and even some of the independent living facilities that had restricted access. So we had gains in what our business model represents, because they turned to us to make sure their clients could stay at home and still have that safety factor and those benefits in place. So, and a lot of times there's confusion in the industry when people think of, if a person goes from home and they decide to go into an assisted living facility, and what the true benefits of that are. So what it did is it gave us a lot more opportunity to educate the public from when they were calling and inquiring to us, what could we do for them? A lot of people were surprised at what we could do in the home setting, and what assisted living facilities at times are limited in what they can do. Because for everyone on the call here, if you haven't been to an assisted living facility, they are not all created equal. The quality levels are obviously different, and it goes with cost. But having one-on-one care and medication management, all these things are extras and additives and in that marketplace. So this COVID gave us such a better opportunity for people to inquire more about what the difference is between those options. And for the clients that are currently with us, that had their clients with us, they really saw the benefits of that and what we were able to do for the clients to really protect them. We were able to shield our clients and their families from this epidemic in ways you couldn't do it at assisted living facilities, as you guys saw all over the news. So we were able to provide an extra level of security for these families, where they were still able to see their loved ones. So as a business owner, seeing that positive impact on the community that you live in, and the thanks and the gratitude, that's why we do what we do every day. That's where you make a difference, and that's the real reason of getting in this business, is to make a difference in your communities with that quality of care with this growing senior population.
And then if you look at it from the business side, because we have multiple revenue opportunities and channels that we work with, it provided our franchisees with opportunities in other areas where, if they did have a dip in their home care, in the number of home care clients, we were able to offset that with national accounts and with temperature checks and with other opportunities that we can do through the national account opportunities. So if it wasn't, perhaps they did quite a bit of work in workman's comp before, that portion of the national account market segment went down, but then other areas went up, such as VA and some of the commercial insurance and long-term care insurance. Those types of areas are opportunities that we have that other brands in this industry don't have. So from a brand perspective, we fared very, very well, and our franchisees are seeing growth over year. So that's all great. And then if you're looking at this business and this industry versus others, I mean, this industry, as we talked about in the beginning, the demographic continues to grow, the opportunity continues to grow, and it's a needed service, and it's a needed service that will be around forever, and we'll be able to provide that.
Fantastic. Awesome. You guys are making all really great points. And this kind of leads into a summary of what we've been talking about for the past half an hour or so, with some of the key takeaways before we start tackling some of the questions. So yeah, as far as I guess the biggest changes or the biggest things to consider is that shifting demographic landscape. So as Pete and Rob have both attested to, there's no ignoring the fact that America is getting older in many respects, which positions home healthcare companies in a strong, puts them in a strong position. And then that shift in how healthcare is being delivered through these relationships with home service providers and other major organizations like hospitals and insurers, and things like that, and business owners in the home healthcare segment are in a unique position to keep growing. And then that last bucket, Rob, you touched on this. Just the community impact is huge. When somebody's considering becoming a business owner, one question I imagine you asked yourself when you're considering becoming a franchisee is what impact do you want to have beyond just making money? What do you want your business to do for others, and how you can change other people's lives and things like that. So I don't know if is there anything else that you want to add to that side of things, or any kind of anecdotes that you that really stand out to you from your time as a franchisee?
Yeah, I mean, that community impact, that's why I was kind of getting passionate about it at the end in that last segment is when you see the gratitude in this business, and when you learn this industry, it's so confusing and difficult to navigate for families. And there are so many emotions involved in caring for family members. Your ability to go into someone's living room and take the weight of the world that seems to be on that family's shoulders and remove that and supply a solution that they could tap into that changes the way that their lives are going down. It's just, I can't even speak words of what that feels like. And then the other side that we're not talking about is that community impact outside of the patients, the caregivers that we employ, the number of families that you're employing, and by doing your job right and getting new business and putting food on everyone's table. I mean, it is a big deal when you have, let's say last week, 120 employees that were, getting paychecks to. Some of these are full-time, part-time, and mixed, all these different reasons, just the impact of what we do on their families. It's just such a unique business opportunity to integrate with the community and families that you definitely have every single day that you're doing something that's making you proud as a business owner of what you're delivering in a product to your community. So not taking away from any other businesses, but impacting families in this way by caring for loved ones, it's at the top of the list.
Awesome. Cool. So that kind of takes us through. Is there anything else, Pete, that you wanted to add before we jump into the question and answer section?
I can't top what Rob just said. That is really what this is all about. So it's and that's what we find with franchisees. They join our company and join this brand because they've had some experience and some personal experience with home care, whether it was their immediate family or somebody else, and they're drawn to it. And to have that. Have the passion about the business is the key, and that's where our most successful franchisees usually come from. So couldn't have said it better, Rob.
Thanks.
Nice. All right. A dramatic shift to the next screen. Cool. So we're going to answer or ask a few questions before we wrap things up. Just a couple questions that came in, and most of them are directed at Rob, but I think one of them is for you, Pete. So one of the questions was, how do you generate business as a new franchisee? Like, how do you are you getting things off the ground?
Off the ground. That's a great leading question. It's a dangerous one. Every way you can. No, no. The way that the model presents itself is, you know, when you start out, the beauty of with BrightStar Care is you do have a national book of business that you could tap into immediately. So that's a plus to get things rolling. The way that the websites are made and created, phone calls are generated pretty quickly. So that digital ad campaign with BrightStar Care is fantastic. So that gets the phone ringing. Then it's just getting out into the community, going to community events, a lot of chamber meetings, meeting with a lot of referrals. Could be anything from, you know, senior, you know, attorneys, right? So planners, attorneys that are dealing with, you know, financial planning, elder law. Obviously, those are key ones. And then every single hospital that has discharge planners, that's who you're going to and getting in front of, or they're now really emailing and making phone calls to in this environment. The rehab facilities, the assisted living facilities, independent living facilities. These are all places that you're going to where your clients may end up at one point, but in some of those instances, they need extra help even in those facilities. But Pete touched on even staffing opportunities. So all of it is, you know, right there for you to go out in the community and have those contacts right away. There's a lot of meetings that you can go to, or community health meetings that are easily accessible, and a lot of these are online right now. So it's not that hard to get the ball rolling.
As a brand new franchisee too, we're doing a lot of things through our START program, which is the training program, to get the word out and let people know, especially if you're entering into a market where we may not have as large a presence as we do in, say, Florida and some of our other states. So, you know, we've done some creative things like PPE gift baskets, and, you know, that's been getting some great social media engagement on Facebook, and it's just, you know, it's being creative like that, because with COVID, sometimes in some states we can't get in to meet with the discharge planners face to face, so we have to be creative and have to separate ourselves a little bit differently that way. So there are a number of training of things in training that you'll go through with our team to help you get the business launched.
Awesome. And then I think you guys have already touched on this a bit, but the different opportunities to diversify your revenue streams.
Yeah, so it's just, I mean, some that are in flight right now. So we've got you know, you obviously have your personal companion care and your skilled care, but then staffing has been huge. So staffing opportunities have been big throughout COVID and in general. So you know, so we've got our existing national account base that we work from. The COVID testing and the vaccine trials, you know, that's an area that we're involved with. VA and military, we haven't really talked about that, but we do quite a bit of business with the VA. And TRICARE, which is the military portion of that. So there's opportunities to grow there. And then regional partnerships are another, where it may not be a national account, but we've got you know, opportunities within a specific region for those franchisees. So you're able to grow that as well. And one of the things that we set up that's unique as well is centralized intake for our national account partners. So it makes it even easier. You know, when I mentioned how the discharge planners love us because it's one phone call and we can take care of whatever needs that they have, it's the same thing with our national accounts. We've got a centralized intake process where they call, and then we can provide them, instead of them calling 340 offices, they can call us, and we can channel that business to the right franchisee. So, you know, and then our franchisees, of course, continue to uncover opportunities as well because they're out in the field. So there's a lot of opportunity in different areas that you can go, and I think that's really important to have that flexibility and have those different revenue streams to offset if one dips or one rises, and you're able to pivot and move towards that.
Awesome. Cool. And then just a couple more questions here. Rob, if you had the opportunity to open a BrightStar Care during the pandemic, what would your response be?
Open it during the pandemic?
Yes.
Yeah, I mean, I am. So I can speak to that. Yes, we're actually opening our third location. We just submitted our state licensing application, so I could speak to that very easily. It hasn't changed the opportunities to service the client. So it really hasn't made a difference on how I look at entering this business model because the need still exists. Like Pete said, it's how you look at what the opportunities are in front of you. So prime example of, once again, getting behind a franchise like BrightStar is this. We have a tremendous opportunity right now with multiple companies where we're doing clinical trials that are all based on COVID-19. So that's actually real events happening right now. You see it all over the news. That's something we're participating in that is adding a lot to the bottom line right now. So those opportunities are still out there. But even if you look at just the whole reason that we do this business model, people are still having to go to the hospital. They're still getting discharged. They're still getting older. They're still having dementia. They're still needing assistance with daily living. People are still getting injured on the job. None of those things are stopping. Now, whether they've shrunk, that is definitely the case in scope. But the biggest differential there right now is when you are a preferred provider, and once again, not to jump on your coattails, Pete, but when you have all those and you could be the go-to because you do all of the above, people are looking for quick solutions that they could count on. And so even though there's less of a pool of some of the products or the services that are needed, this brand allows you the opportunity to be on top of that list. So that's how I look at entering the market right now. I think it's as good a time as any.
Excellent. Cool. And the last one, Pete, I think this is directed to you about if BrightStar Care is looking at any specific markets for expansion.
We are actually, yep. And so we have opportunities all across the country. In some of the major metro areas, we have some areas that are sold out, but in almost every state that there are definitely opportunities available. We have some states that we're looking at, and states such as Louisiana, and especially areas that we don't have coverage today, and areas that have open territories. We are looking at a conversion opportunity as well. So there may be existing home care locations that are independent and maybe only do personal or companion care and are looking to expand. That's an opportunity. But I mean, I would suggest we have people that handle the East and West Coast, and if you have a specific market, you can look at the website, and there's a territory map on brightstarfranchising.com, and that will give you a look at all the open territories that are out there. But there's plenty of room for growth all across the country.
Awesome. All right, we're butting up against the 45-minute mark, so I'm gonna wrap things up quickly. There we go. So yeah, as Pete mentioned, if you're interested in learning anything more about becoming a business owner in the home care industry, the BrightStar Care franchising website has a whole lot of information. So we encourage you to visit that site, www.brightstarfranchising.com. That will open up the main page, which gives you an opportunity to look at home care or the senior living opportunity. You can download the franchise brochure to learn even more detailed information from there. So encourage anybody interested in learning more to do so. And then just lastly, just want to thank Pete and Rob, both of you, for joining the conversation today. It's been, I think, really enlightening, a lot of great information, and a lot of details that you probably won't find just kind of snooping the web. So yeah, I appreciate both of you joining us, as well as everyone in attendance today. Thank you guys for sticking around and listening to us talk.
Thanks, everybody.
Thanks. Y'all have a good one.
All right. Take care, everyone.